All right, the next entity we're going to talk about is called a granular cell tumor. This is a really fun tumor because it's so easy to recognize under the microscope. Typically presents in adults. Over 90% of these are solitary tumors. The most common location is the mouth, but really anywhere in the oral mucosa can be involved. The tongue is the most common site, but any location in the oral mucosa can be involved, and then the skin as well as other organs. Typically presents as a skin-colored verrucous ulcerated nodule. It's usually asymptomatic, but can be mildly itchy or tender. When rapid growth occurs in these tumors with ulceration, and if they're large in size, that's when we get concerned for a malignant granular cell tumor. But this tumor that I'm showing you today, you can see that there's a little bit of overlying epidermis or epithelium, because this is a mucosal biopsy. So this is mucosal epithelium, and we know it's mucosal epithelium because we don't have a granular layer. And then beneath this area of the mucosal epithelium is really this huge nodule. There are a lot of ectatic blood vessels, but you've got this huge nodule beneath it. Now, granular cell tumors tend to be very ill-defined, and they tend to present as these infiltrative masses in the dermis and the subcutis. Again, we're in the mucosa, so we'll be talking about submucosa. And the composite cells are really characteristic. They're these large polyhedral shaped cells arranged in nests and cords, which is really hard to appreciate because here we just kind of have a diffuse mass of these cells. But you can make out the polyhedral shape of these cells. The cells also have very abundant, finely granular cytoplasm. And when you go up and down on your focus knob, you'll be able to appreciate the granules in the cytoplasm of these cells. The cells also have these very small, kind of round, centrally placed nuclei. As you can see, round central nuclei. So in the middle of these polyhedral cells, you'll have these small round nuclei. And then the cytoplasm is full of these eosinophilic granules. That's your classic granular cell. Sometimes you'll see these small, what I like to refer to as condensations of the granules into these pink globs or intracytoplasmic spherules. And these are usually referred to as pustula-ovoid bodies of Millian. And they're really just condensations of membrane-bound lysosomes. And I'm going to try to find a good example of one of that structure here. It can be sometimes hard to appreciate. And I'm not finding any great examples. Maybe right here. Right there. Right there. So these are just really pink globs, which I like to refer to as condensations of the granules within the cytoplasm, and they're referred to as pustula-ovoid bodies. So that's important to remember, that association with granular cell tumor, that can be a question on a quiz or an exam. Pustula-ovoid bodies of Millian. So that's your granular cell tumor.